Hi, my name is Dr. David Tenner of the Goldberg Clinic for Chronic Disease Reversal located in Atlanta, Georgia. Today I'd like to present an interview with a patient that we've been working with for the past few weeks. The patient came to see us with a diagnosis of gastroesophageal reflux disease, or what's more commonly referred to as heartburn. In a matter of a few short weeks in working with us, the patient experienced a complete remission of the symptoms, and as a side effect of getting healthy, has also enjoyed a significant loss of weight and much more energy in his daily life. The following interview is a detailed account of the patient's experience with us at the clinic and the significant improvements that he has seen while under our care.
Hi, this is Dr. Paul Goldberg of the Goldberg Clinic. We're here today with David Kentop to talk about his experience at the Goldberg Clinic. And one of the reasons I particularly wanted to talk about David's case is because he came in concerned and troubled with a very, very common symptom that we see in the U.S. population called gastroesophageal reflux disease, what people commonly refer to as heartburn, where some of the stomach acid actually splashes up into the lower portion of the esophagus and gives a burning sensation as if the heart was burning. Actually has nothing to do with the heart. One of the amazing things and unfortunate things we see in practice is so many people come to our clinic, to the Goldberg Clinic, with complaints of this thing called heartburn. Now oftentimes they're coming to complain or with trouble with rheumatoid arthritis or lupus or some other problem, but when we talk to them they tell us that they also have this gastroesophageal reflux disease, also known as heartburn, and their physicians have them on a variety of antacid medications, whether that be Nexium or Prevacid or some other medication to either neutralize the stomach acid or to actually prevent the stomach from producing acid. That's a big mistake. People don't realize how important stomach acid is. It neutralizes bad bacteria that get into the gut and keeps them from getting to the small intestine. Very important function. It tends to get rid of protozoa and other parasites to keep them from getting to the small intestine. It makes minerals more soluble, and it also, if that was not enough, it also prepares the first portion of the small intestine to become acidic temporarily to allow for something called the alkaline tide, which is where the pancreas sends in a rush of bicarbonate in order to neutralize that acid, and that's what allows for the pancreatic enzymes to be activated to digest proteins, carbohydrates, and fats. And without that, we can't transform food into human flesh, not properly. So it's a huge mistake to neutralize all this stomach acid. And people who have heartburn think they have too much stomach acid. That's not the case. It's really that it just gets in the wrong place. So David came to us complaining of fatigue and complaining of heartburn, which had gone on for quite a while. How long had you had the heartburn and the fatigue for, David?
The fatigue has been for a number of years. The heartburn has kind of been on and off probably for the past year and a half.
About a year and a half, and the fatigue for longer than that.
Yeah.
And what's your age now, David?
33.
33. So David's a young person, but we're seeing this so-called heartburn occur even in very, very young people now. All right, David, tell us what was your experience in coming here. How did we address your heartburn, and what's been the outcome?
First, I was on this fast for 2 weeks. I was put on this metabolic primer protein. Okay. I was also put on this fiber mix that you have me take.
So we put you on a special diet.
Yeah, special
Gave
diet.
you a few supplements to take.
Absolutely.
Gave you some advice about not overeating.
Correct.
And we rested your gut for a period of time.
Yes, you did.
Is that all correct?
Absolutely. That's
correct. Okay. And what have been the results?
The first few days when I started the fast, I was still having the heartburn, even though I wasn't eating. But I would say probably about day 2, the heartburn went away, and ever since then, it hasn't come back.
Ever since then, it has not come back.
Yeah.
What was the most important thing you think I told you during that time? Because now we're going to get ready to release you pretty soon. We don't want the heartburn to return. What's the one thing you have to remember now?
To not eat to the point where I'm completely full.
Right.
Eat just about 2/3. Keep 1/3 of my stomach empty.
Keep 1/3 of your stomach empty. And what's also going on in terms of your fatigue?
It's pretty much gone away. I'd say my energy levels have definitely improved vastly. I'm nowhere near as tired as I used to be. So it's just overall just healthier.
Excellent. So there was no miracle pills. There was no miracle treatments. Just good common sense of analyzing the patient carefully, understanding their biochemical individuality, David also had a few food allergies we had to eliminate. And now he's prepared to take care of himself, avoid the heartburn, doesn't have to go on prescription drugs, and to have a healthier and we hope a much happier life. And David, did you want to give your phone number out for any of the young women out there?
No,
He's not going to do
that's
that.
okay. My girlfriend will kill me.
Your girlfriend will kill him. All right, we won't do that. All right, thank you very much.
Thank you very much.
Appreciate it.
Appreciate it.